Good afternoon. My name is Alexis Smith. I am a senior at Kennesaw State University majoring in medical sociology. This summer, I interned at Piedmont Atlanta Hospital. Here's a little background about the hospital. Piedmont Atlanta Hospital is actually part of a bigger healthcare system called Piedmont Healthcare. It's one of 7 hospitals located around the state of Georgia. The healthcare system as a whole is a nonprofit who gets their donations from patients, staff members, and private companies. Piedmont Atlanta specifically is ranked top acute care hospital in Metro Atlanta area, and is also ranked top 5 in patient satisfaction surveys. Piedmont Atlanta is located in Midtown off of Peachtree Road. They provide services such as 24-hour emergency, heart and cancer care, transport medicine, and women's health services, which includes anything from mammograms to annual physicals. There are several different departments in Piedmont Atlanta Hospital, but I chose the emergency department because of the fast pace, the quick thinking on their feet by staff members, and multiple interactions from providers to patients to staff and everywhere in between. The emergency department services include ensuring patients' vital signs are in good standing condition, taking all patients regardless of if they have insurance or not, giving MRIs and EKGs to those with head pains, chest pains, etc., because a lot of times that means that it's heading to some kind of illness that could be potentially fatal or even more serious than it's letting on. This is also a fun fact. They take in ambulance cases regardless of where the ambulance is coming from, which is something I didn't know coming into the hospital. Like, they would get ambulances from Athens, from Grady, from everywhere, and they would take them. Upon entering the hospital each morning, I would make my way around the emergency department, making sure all the medical forms were stocked to make sure that when they were needed, they didn't have to go looking for them, which could at times put the patient at risk because it takes up time. I helped the registration desk, which is where I was primarily situated throughout my internship. I helped them place armbands on the patients. What I would do is once the patient was registered, I would go around to the patient and have them verify their first and last name and date of birth before placing the armband on their arm, because they weren't allowed to place the armband themselves. I would transport wheelchair-bound patients to the waiting area or any other departments that they would have to go to, or if they needed a wheelchair upon entering the hospital, I would rush and get them one. I escorted patients, family, and friends to see a particular patient that was already admitted into the hospital, or to certain departments where their family members were waiting for them. I made sure that the emergency department as a whole was always clean and organized, which made the medical staff lives easier, but it also showed to the patients coming in that Piedmont Atlanta is a place of cleanliness and organization. Lastly, I answered the phone. I was actually given a script. I would always have to answer the phone saying, "Thank you for calling Piedmont Atlanta Hospital. This is the emergency department. How can I help you?" Even though I wasn't able to get as hands-on with the patients and medical staff as I wanted to because I was a nursing major, I still learned a lot through daily interactions, through observing people around me, and everything else, using all my resources. I learned in the emergency department that each member of the medical staff has different colored scrubs, which is pretty interesting. For example, green scrubs meant that they were medical techs, which means they were in charge of taking vital signs, MRIs, EKGs, etc. Tan scrubs, which is interesting, they were secretaries, and only in the emergency department were secretaries required to wear tan scrubs or scrubs at all. Black scrubs were transport people, which means their specific job was to transport people that were already hooked up to IVs and laying in the little stretcher beds. They would transport them to different departments of the hospital while they were still in the beds, or they would transport wheelchair-bound patients. They had navy blue scrubs. They were nurses, and light blue scrubs were the doctors. throughout my 2 months working at this hospital, I was only able to really learn about a fourth of the hospital as a whole, because Piedmont, Atlanta is actually one of the largest hospitals in the Piedmont healthcare system. So, yeah, it's pretty huge. I was able to figure out where labor and delivery was actually not a part of the emergency department, which is something I learned because I didn't know going in. They were actually a different wing. Women's health care was on a different wing on the other side of the hospital as a whole, which is like going into a separate world, because they had everything. They had the OBGYNs, annual physicals. They had a lot of mammograms, prenatal stuff, pregnancy services. They also had a transplant center, which I learned Piedmont Atlanta Hospital is the only hospital in the Piedmont healthcare system that has a transplant center. That was interesting. Something else was the communication between the departments consisted mainly of phone calls and code names. Like, each staff member that was on their feet all the time was given a required cell phone that they had to carry around on them in addition to their own cell phone. And they used code names like Code Black would mean a bomb threat, and Code Walker would mean there is a missing patient. When it comes to the hospital organization as a whole, there are inequalities that still exist when it comes to treatment, care, biases, etc., which exist unconsciously and consciously. Those in the healthcare use characteristics such as race, gender, and sexuality to make medical decisions, sometimes without even knowing it, especially when it comes to race. As a result, this could greatly health status and attitudes towards the healthcare field for minorities are negatively impacted. The persistence of racial inequalities is kept alive through communication tactics and societal, cultural, historical level differences. In terms of communication, minorities are a lot of times more subjected to more domineering and demanding forms of communication by their providers and the medical staff, which causes them not to want to share their problems because they're frightened that they might be judged because of their physical characteristics, which causes them to kind of clam up and not tell them every single symptom that they have, which may be really helpful to pinpointing exactly what kind of illness they have, which can be detrimental to their health in the long run or short term. For the majority, on the other hand, providers are more likely to show sympathy and openness, which can make their patients more comfortable and more welcomed, which causes them to be more open about their symptoms, which in turn will help their health. At a societal level, there's indirect discrimination with where minorities are housed in the environments they live in. For example, in certain minority neighborhoods around the area, you may have maybe one grocery store that's like 30 minutes away, as opposed to a fast food restaurant right on that corner, maybe a short distance walk, which could greatly hinder their health because they're not getting the adequate amount of nutrients that they need. Also, their access to quality health care can maybe be about an hour away, which stops them from even wanting to go or having transportation to get there. Cultural differences can cause confusion between provider and patient, which could cause the provider to not be able to give them the accurate amount of treatment options. Historical differences could cause skepticism. Like, for example, African Americans were historically mistreated by the hospital organization as a whole, which makes them even skeptical today to ask a provider for help. Experiences as a racial minority greatly differ from the majority. Perceived discrimination is a big one. Perceived discrimination deters potential patients, which causes harm to themselves. It also causes people to act in ways they normally wouldn't for fear of not being for the fact of not being portrayed negatively. It causes minorities to forego doctors altogether. They may wait until the last minute to go seek help, Or when a doctor comes and tells them to come in for a follow-up, they might not do that at all, which could cause the health issue to get worse or not be treated properly. When it comes to cultural competency, when a majority of hospital members are one race, the minority will oftentimes feel that their own cultural differences will be ignored or not taken seriously when it comes to treatment options. Minorities also report feeling not equally respected, and that providers are hesitant to include their cultural differences in treatment options. When it comes to preventative measures, healthcare professionals will oftentimes give differing preventative advice to patients depending on their skin color and or their personal bias. The theory of functionalism is exemplified by the hospital organization as a whole. Functionalism is when a society works together to maintain the state of equilibrium and stability. A hospital has its own advanced system of workers and duties in order to keep it running efficiently. You have the differing levels of workers in the organization. At the top, you have doctors, because they're responsible for ultimately treating the patient. Just below that, you have the nurses, who assess the patients to determine the seriousness of the illness and whether or not seeing a doctor is even necessary. Below that, you have the clinical staff, which are responsible for taking the vitals, MRIs, and anything else. Then below them are like all the other staff, which are basically responsible for keeping the hospital clean, transporting patients, taking care of equipment malfunctions. Basically, it's a majority of them that really keep the hospital stable. An example would be a patient enters the emergency department. They're immediately directed to the registration desk where they're registered and given an armband. They are then called by their name to triage to have their vital signs taken by the clinical staff. They are then pulled out into a waiting area where they are called by nurses to be further assessed, where they are either given a prescription, or if their illness is serious enough, they'll be seen by a doctor. Since beginning my major in sociology, I became more observant of the interactions, gestures, and body language of the people in their everyday lives. I've seen how much cultural differences, social status, and financial stature greatly determine someone's residence and their treatment by others. Medical sociology has given me insight into the medical world and how they aren't taught everything in school, but they learn from trial and error just as we do, which made me see doctors on a more humane level, not sit upside a pedestal like the rest of society sees them. Race and ethnicity helped me to analyze how different cultures act and interact in hospitals. Society, community, and health taught me how those with insurance are treated more efficiently than those without. Advice I have for people looking to intern at hospitals in general, not just Piedmont, Atlanta, definitely be open-minded, expecting unexpected. You never know what people are going through when they come into the hospital, so it's always best not to judge them based on what they're coming in for. Have a lot of patience, because when people do come into the hospital, they're not in their normal state, so it may cause them to act differently. Dress professionally. Just because you're not working there, you're still representing the hospital as a whole. Ask as many questions as possible. People are always there to answer them. And take advantage of all the resources made available to you, definitely. Thank you.